this lesson, we're going to talk about the anion gap and what it means for your patient. So to get started, the anion gap, the normal measurement is going to be 3 to 11 milliequivalents per liter. And what the anion gap is that it's a measurement of the cations and the anions. So the cations are positively charged ions and anions are negatively charged ions. And they're all in the body. So we're going to take a look into how we get this measurement. So in our body, we have all these molecules, and some of them are positively charged and some of them are negatively charged. So the positively charged ions are called cations, and the negatively charged ions are called anions. And examples of positively charged ions are going to be things like hydrogen and potassium and sodium. And negatively charged examples are things like chloride and bicarb. So if you go to our lesson on arterial blood gases, you can get better ideas and understanding into some things that can cause conditions like metabolic acidosis or respiratory alkalosis. And these are conditions where the pH in the blood gets changed and it changes the pH of the body. And this is where all of these molecules come into play. But what we want to look at specifically here is what we need to do in order to get the measurement, and how does the values of these in comparison to one another change the pH. And the way we do that is by looking at this equation right here. When you do an anion gap, what you're looking for is the difference in the measurement between the positive and negatively charged ions. So potassium is positive, sodium is positive. So we're going to add these two together, and then we're going to look at the difference between the chloride and the bicarb here, because these are negatively charged. So let's look at an example. So let's say our sodium is 135, our potassium is 4, our chloride is 105, and our bicarb is, let's say it's 25. So you add these two together and you get 139. And then you get these two together, you get 130. We're going to subtract these. It's going to give you 9 milliequivalents per liter. This tells us that all of the extra anions account for 9 milliequivalents per liter. That's what this thing is right here. So this is the value of all of your ions. So these are all positive, these are all negative. So this is 139 and this is 130. So that means that this remaining 9 are other anions. So those things could be like things like lactic acids, keto acids, other things that accumulate in the blood. Now you can have increases in these and still have these values still be normal, and you get an excessive. So let's say your chloride bumped down to 100, still technically normal, but now do some erasing here. So now your value here is 125. So now your gap, instead of being 9, is technically 14. So now this is not normal anymore. So now you have, your gap is increased. So this is an abnormal. So now you have this additional increase. So now you have more acid, and this could be accumulating from maybe lactic acid or keto acid. But this causes the specific changes in the pH, and this is what we're actually looking at. So things that we need to think about when we're submitting these samples, we're going to use the red or the green top tubes to submit them. They're commonly going to be submitted with other panels, so maybe your comprehensive metabolic panel, and it's also going to take into account the electrolytes. There are 3 situations where you're actually going to have changes in gap. You're going to increase anion gap, you're going to have a normal anion gap, but the patient's pH is off, and then you're going to have a decreased anion gap. With your increased anion gap, you want to remember the mnemonic mud pile. So it literally stands for the things that are going to cause increases in the anion gap, or an increase in the amount of negatively charged anions, or negatively charged ions, or the anions. So methanol, uremia, diabetic ketoacidosis, propylene glycol toxicity, infection, lactic acidosis, ethylene glycol toxicity, and salicylate poisoning. So you've got all of these things. This is renal related. This is your DKA that you need to worry about. Your lactic acidosis is going to be due from different types of potential trauma. or sepsis, and these other things. So you've obviously got infection, but then these other things are addition, like some sort of like toxicity or poisoning. Now you're going to have decreased anion gaps, but this is going to be less frequent, but you're going to see this where you have this loss of albumin. So you'll want to pay attention to your albumin levels if you have a decrease. So anything less than 3 milliequivalents per liter. Now your normal anion gap, this is a little bit tricky. So this is a situation where your patient's pH is low. So you've got a low pH, but your anion gap is normal, or what we call a closed gap. So if you ever hear the phrase, is the gap closed, they're referring to making sure that the anion gap level is between the 3 and 11 milliequivalents per liter. But you're going to see this is going to be normal. Your gap is going to be normal, but they have a decreased pH. So like on their ABGs, this is why it happens. You have a loss of bicarbonate somewhere. So you either have it through diarrhea, so through the stool, or you have a loss of bicarb through renal failure. So what you're going to have to do is correct the pH. So if you correct the patient's bicarb, this should improve that patient's pH level. In this lesson for our nursing concepts for anion gap, we look at our lab values and then we pay attention to the acid-base balance, because that anion gap is going to give us so much information about our acid-base balance. So let's recap. The normal values for an anion gap is 3 to 11 milliequivalents per liter. And remember that the formula you're looking for is you're looking for the difference in the anions. So we're paying attention to the potassium, the sodium, the chloride, and the bicarb. You want to add your positively charged ions. You want to add your negatively charged ions, and you want to find the difference between the two. The increase in gap is caused by those other acids that are accumulating in the body. Now, mud piles is the mnemonic you want to remember. That's methanol, uremia, diabetic ketoacidosis, propylene glycol poisoning, infection, lactic acid buildup, ethylene glycol poisoning, and salicylate toxicity. Also remember that you can have a normal anion gap with a decrease in pH, but it's going to be caused by this loss of bicarb either through the stool or through the kidneys. So that's our lesson on anion gap. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today, and as always, happy nursing.